Well, let's get started because we do have a pretty packed agenda today. So, um, if folks, the plan is that we're gonna probably present for the next 50 to 60 minutes and have a little time for Q&A at the end. And then I think our panel here is going to hang around for 30 minutes after the end of the presentation for additional questions and conversations. But we're hoping that, today's topic, talking about transforming organizations and systems to reduce turnover and to support wraparound workforce will be something that generates a lot of discussion. I think folks, this is something that comes up often in the work that we do, and hopefully other folks kind of feel passionate about this and have thoughts and ideas around kind of what's happening, in your own states and organizations. But before we begin, just a few housekeeping things. We will be, like I said, have a Q&A at the end, so a chance to ask questions. But if things come up throughout while we're talking, please feel free to drop them in the chat. We have folks from our team here, Eric, Covey, who will be monitoring the chat. And if there's a question that comes up that needs to be addressed right away, I'm sure they'll chime in and so that we can provide some clarification. But feel free to drop those questions in the chat, and at the end we can visit those at the Q&A part. Also, this is being recorded. The recordings will be posted to the NWI website after the session is recorded and downloaded. It'll be up there for everybody to go and watch again or share with folks who couldn't make it. I think that's all for the housekeeping things. We will, in that queue at the end, in that conversation part, folks will be able to come off mute if they want and raise their hand and ask a question, but I think they have to use the raise the hand function to ask the question. So we'll prompt you again when that time comes at the end. So we can go to the next slide here. One last housekeeping thing, and will probably be a few plugs for this. For folks who don't know or haven't registered yet, just a quick reminder that the 2025 training institutes are coming up. They'll be in Washington, D.C. in July. So with the pre-institutes being July 6th and 7th, and the full workshops being from July 8th through the 10th. I encourage everybody who may be interested to come. I know I'm very excited about this. I will be presenting on several things. We will actually be diving more into this topic while we're there, along with several other topics that will be relevant to wraparound and to systems as a whole. But it's also a great time to come and network and meet folks from all over the country doing the work that you all are doing, share ideas, and get to know not only other people, but there will be young people and families there as well. So just a wonderful time to kind of share in the work that we do and try to be better at it in the long run. All right, so today, though, we will be presenting about our workforce study, and it'll be myself. So I'm Tony Bonadio. I'm from the Innovations Institute at UConn School of Social Work. I'm a research assistant professor there. My work focuses primarily on evaluation, continuous quality improvement for programs for child-serving systems generally. I work with the National Wraparound Implementation Center, or NWIC, so some folks may have seen me in meetings or talking on other webinars about things related to wraparound through my role at NWIC as the evaluator there. We also do things like fidelity monitoring, outcome monitoring, all to support the work that you all are doing and inform coaching and decision-making using data. So I will be doing a brief introduction, and then John Olson from the Wraparound Evaluation and Research Team, or WIRT, at the University of Washington, who's a close colleague of mine, will be sharing findings. John has been doing outcome evaluation for behavioral health interventions for a long time. Again, he may be familiar to some of you, some of the work that comes out around the outcomes of wraparound. John is somebody who's done a lot to promote that work and share, disseminate those findings. And then finally, my colleague at Innovations, Kim Estep, who's the director of our implementation or system design and implementation strategies division, will be discussing how the findings that John presents, the implication for those findings. And Kim is also the director of NWIC, and so just somebody who's been dedicated the past, I don't even want to guess how many, 20 years maybe, to improving wraparound across the country. And so a lot of insights from the work that she has done over those years. All right, we can go to our next one. Thank you, John. Quick overview of what we'll be talking about. I'm going to try to keep it very brief. Just a quick overview of the study we did, why we did it, how it came to be, and then John will jump into the findings from our study. And so he'll provide a bunch of data based on the responses to the survey that we did. He'll talk a little bit more about the surveys and what was in them and who were the respondents, or who the respondents were, and what types of questions they were answering. And then, as I mentioned, Kim will talk about how those findings can be applied in practice and what those implications may be for states, for systems, for organizations to address something that I feel like is a overwhelming issue for across the country, which is workforce turnover. And so I think it's a common struggle that we hear about. And so hopefully there's some important implications and strategies we can start to figure out based on the data to address it. All right. So John, you can go to the next one. So this is I'm just going to go into the background a bit here. So as I mentioned, I do a lot of continuous quality improvement with states, which requires data collection. And this study kind of came about because so many times when we're doing that data collection, whether it's fidelity monitoring or COMET data, for folks who are familiar with the COMET, that looks at worker skill development, or if it's around just entering data into a spreadsheet to track things, so often this idea that people are overwhelmed because we're understaffed, or it's hard to keep fidelity because everybody's new, because staff keeps turning over. And so this idea of staff retention, staff turnover just kept coming up and up and up. And we said, I feel like we need to address this. We as a group met and said, we really need to try to figure something out around this. Before my tenure with NWIC or with Innovations, Janet Walker, who is director of NWI, co-director of NWI, had done a previous study around this. And so I think we can drop the link in the chat here, but she had done a similar project where she surveyed folks back in, pre-2027 to find out what were the drivers of turnover, what were the impacts of turnover. And so we had that as a basis to go on when we decided that this is something we wanted to pursue. From using Janet's previous work gave us kind of a basis. We then went to the literature and looked around to see what was in the academic literature around staff retention, staff turnover, the impacts of turnover. And importantly, and I think the place we all want to get to, is strategies for addressing those barriers to turnover. And so I'm not going to go through a whole literature review with everybody today, but one of my colleagues, Jessica Lim, put together a blog post that highlights the findings from the literature, as well as gives the resources so folks can if they're interested and want to go look at what's out there in the academic literature, they can there's a resource there that they can turn to. The other, I think, important part about the work that Jessica did in the literature review is that it provided a basis for what we need to ask, like what is in the literature around the drivers to turnover. So John, you can go to the next slide. So that's kind of where we got started. So we developed our research questions, one based on the anecdotal things we were hearing from folks around the struggle with staff retention. And we then looked at what Janet had done previously to see what she had found, and we wanted to see if those things still held true around what were the drivers of retention or turnover. And with that, we also went to the literature, and we saw things like organizational culture, worker support, as well as things that probably everybody thinks of when they hear this: pay, administrative overload, paperwork, and then just kind of being burnout because of being understaffed and doing multiple jobs. So we pulled the information we had from the literature and from Janet to develop our research questions. And then we wanted to be able to gather that information both from an organizational level. What does your organization look like in terms of vacancies, in terms of rates of turnover? So we wanted that at an organizational level, but we also were interested in, and what are workers' experience there? So we had, and John will talk more about this, surveys that looked at the organization and gave us details about the organization, as well as a survey of individual staff and supervisors where they could provide information around those other factors that may drive turnover, such as the pay, worker support, organizational culture. And so we took all of that, we came up with surveys, put them into Qualtrics, and we reached out through our various networks to recruit folks who may be interested. And I think one of the things that we see in the literature, and I think that John may show kind of as we go through today, is that we find the turnover is not just an individual organization or an individual problem, an individual organizational problem, but a systemic problem. There's kind of multiple levels that impact turnover, everything from rates, Medicaid rates, all the way down to individual organizational fit and culture. And so I think from there, I'm going to turn it over to John to kind of walk through the specifics about what we asked and what we found.
All right. Yeah, thank you, Tony. Thanks for the great introduction. And yeah, as Tony said, there was a lot of factors, a lot of things that we looked at here. We're excited. First, I'll say I want to thank. I'm sure many of you in the audience today probably participated in this survey as well. So for those of you who did, thank you, and for those that did not, thank you for coming today. And I'm excited to share some of these findings. We all are excited to share these findings. So I'm going to start with just a brief overview of some of the methods, just a couple of slides. I'm not going to go into a lot of detail, but just to give you a little bit of a sense of what it is that we did before I go into what we found. A lot of data slides here. I find it exciting. I'm a data guy, I guess, but I think you'll find it compelling. I think it's an interesting story. And as Tony said, we're going to be diving deeper and deeper into this rich data set over the coming months. But we already have a lot to present today. So let me jump into it. Get to advance. There we go. So the data that we're presenting today were drawn from the surveys that Tony described of wraparound administrators. So these are sort of the leadership of wraparound provider organizations, and then also care coordinators and supervisors. So these surveys were distributed about a year ago, and then we crunched the numbers and whatnot. And we're excited to finally start to present these data publicly to you all. The sampling frame, and by sampling frame, what I mean is all the possible organizations that could have participated. So that's where we started. We reached out to 119 provider organizations. 65 of them returned valid surveys, which was a 54.6% response rate, which in these days is a pretty good response rate for a survey. We always want to get as high as we can, but we got over half of those organizations are represented in this sample. The sample includes 210 care coordinators. Also, I know some of you use the term facilitators. Those are the same, one and the same. Care coordinators and facilitators are in that group of 210 professionals. 55 supervisors, 67 administrators. As we go through, you'll see some of the sample sizes on my slides look a little bit lower than that. That's because of missing data or incomplete data, but we drew what we could with the valid data that we have. So you'll see as we move through the slide. There were two versions of the survey, one specifically for administrators, and then another for the care coordinators and supervisors. And the only real difference is the administrators provided more of that background information on the provider organization characteristics, the actual turnover rates, staffing patterns, and then there were a whole host of questions on perceptions of turnover-related problems, causes, and retention reasons. The care coordinators and supervisors, like I said, had a similar but shorter survey, same questions on turnover-related problems, causes, and retention reasons. And then also a series of questions related to organizational climate, kind of the characteristics of that provider organization. You'll see those as we go through. All right, so let me move to the next slide. We're going to start with the results, basically the scope of turnover. This is the basic numbers. Before I jump too far in, I would like to know what you all think. I've separated this out. So we're going to do a quick poll for care coordinators and a second poll for supervisors. If you can see, what do you think is the annual turnover rate for care coordinators? And for those of you that are detail oriented, you saw there is a number in our promotional materials for this webinar, but it's a little bit different when you look at separately, when you separate out the different roles for care coordinators and supervisors. So we'll start with care coordinators, and we'll jump into supervisors, and then we'll jump into what the data actually said. Have numbers coming up yet? I don't see it on my screen. There we go. All right, so the bulk of you, looks like the most common choice was in the 26 to 50% range, with some folks a little bit less and some a little bit more. Okay, and I'm guessing a lot of this has to do with your own experiences, and you'll see in the data, there will be a range. So, okay, let's move on to the next poll. That's for our care coordinators. Let's move on to the next, which will be for the supervisors. And we'll give this a minute to populate. As soon as we get our results, we'll put them up. Okay, and you have it is a little bit lower for the supervisors. So what you all need to have a good pulse on what we're seeing as well. So which is great. Let me get into some of the numbers here. The data suggests that about a third of care coordinators, 34.3% to be precise, were reported as having turned over in the preceding year, and about a quarter of supervisors, 24.2. So pretty much spot on with you what you see. And of course, as you know, when you look at averages, there's a range of scores around that, and that's what we saw. And I'll show you in a couple of slides what that looks like. One thing that's interesting, we also looked at the percent of staff who left their jobs within the first year, that rapid turnover, which can be particularly stressful for organizations to be in that constant pattern of having to replace staff. This graphic is a little wonky, but let me walk you through it. So along the bottom, these are the percentages of organizations that responded, and then we have the percent who left on the y-axis here. So 17% of organizations had nobody leave. Of those who left, they did not leave within the past year. But nearly a third had nearly all of those who left within that first year. The average, if you went across this, I didn't put the number on this actual slide, is 53%. So 53% of staff are leaving within 1 year of starting their job. However, we see a lot, now this goes back to just the general turnover rates. We see a lot of variability across provider organizations. So along the x-axis here is the amount of annual turnover, ranging from none all the way up to 75% or more. And these are the percent of care coordinators specifically for the 53 organizations that we had valid data. You see, of those 53, 10 had no turnover in the last year at all. 6 had 75%, almost their entire staff turning over. And it's interesting because this graphic looks about similar to what you all put in the poll as well, right? So we see this range. Okay. Now, when we look at back up from the actual turnover to thinking about leaving, right? If we're going to look to prevent individuals from leaving their jobs or try to retain our staff as best we can. Of course, there's always going to be some attrition over time, but if we want to try to maintain as best we can, we want to get those that are starting to think about leaving, right? So we looked at this variable of participants who said, I either often, very often, or almost daily think about leaving, or sent out a resume, actually acted on that. And what you see are some interesting differences. Not really surprisingly, you see the care coordinators, just like the actual turnover rate is higher, thus thinking about leaving is higher. 42%, either often, very often, or almost daily, thought about leaving their position. 15% actually acted on that in the last year. And that rates are lower than for the supervisors or administrators who responded to the survey. Okay, so let's now move into some of the, so we have established that turnover happens in wraparound. That's not a surprise to any of y'all who are joining us today. And those numbers are about similar to what we see for other fields, other behavioral health professionals. You see estimates ranging from 30 to 35%, some studies a little bit more, some studies a little bit less, but it seems like that 30 to 35% is about what we're seeing out there. So our numbers are consistent. What impact does that have on wraparound? So let's take a look. I'm going to begin again with a poll. This is just an open-ended poll, so we're just going to look at some of the text fields that you put in. Just put in an example, right? I know you could probably write an essay on what do you think are some of the impacts of turnover. Go ahead and write 1 or maybe 2 ideas of what you think are some of the most significant impacts of turnover on implementing wraparound, on doing the good work that we all do. And we'll give you a minute or two since you need to type on this one, and we'll scroll through some of the results that we see.
John, while folks are typing, there's a good question that asks, did the turnover rate account for care coordinators being promoted?
Not in this round of analysis, no. It's a good question. And actually, during the webinar and after, it'd be great to get feedback on some of those things. Like I said, it's a large and rich data set that we're partially digging into, but that's a very, very good point.
That rate across all of the different contexts out there, when it averages out, it includes folks who might have left, probably includes folks, or it might have been up to the respondent to decide if their report of what turnover is in their organization, it might have been up to them to decide if they were reporting on turnover for reasons of people leaving the organization only, or people also being promoted within the organization.
It's worded as left position, but you could see that could be interpreted either way. Left position for a promotion and were actually retained, or left the position to leave the organization. So, but we can look in a little bit deeper to some of the qualitative data that we have as well. We might be able to get at some of those types of questions as we dig deeper. All right, give another moment and maybe post some of the results of what we see.
And Nancy's also making a good comment around people in care coordinator positions who leave those positions and might be included in the turnover stats, also might move into other positions within the organization that aren't necessarily wraparound supervisors or care coordinator supervisors. They might move into, they might get a degree or a license and move into a therapy position. So stuff to unpack.
Yeah. Yeah, absolutely. At the end of the day, it still means care coordinator positions needing to be filled. But yes, it is interesting and important to know where people are moving, right? Um, are we able to see the results? I'm not getting the results quite yet on my screen.
So yeah, it isn't sharing for you, John.
Okay. Okay, so I'm going to trust that these were amazing things that you all wrote.
I could share my screen if you all would like to see some of the responses.
Maybe could somebody else on the panel who can see them, whether it's you, Matt, or somebody else, maybe just read out a handful, maybe 5 or 6 of them, and then we can move through. That would be helpful, and then compare to what we saw in the data itself.
I'm not sure that any of our co-panelists are able to view the results.
Okay.
So I'll read them out for you. These are just some from the first page that came in.
Sure, a little sampling is all. That would be
Sure.
great.
Sounds good. So what do you think are some of the impact of turnover? Challenges to fidelity due to having to start over with coaching and skill building frequently. Family life balance, emotional toll and flexibility. Family dissatisfaction, outcomes not being met, staff moral negatively affected, and a restart of relationship and safety building. Longer wait lists for families. Loss of staff require continued retraining. Organization culture and the amount of pay. Inconsistent work-life balance. Stress, pay, and documentation requirements. Higher caseloads and unfavorable outcomes for families. High volume workload in addition to being intensive. That's just the first page. I could keep going if you'd like, John.
Perfect. These are all in line with what we're seeing in the data. So yeah, thank you, Matt. Thank you for those that responded to the poll. And I apologize if the question is a little unclear. I see some notes in the chat. Point is just to get some discussion going on or some thoughts flowing on what we see as some of the impacts of turnover. So let me jump in to see. Obviously, one of the big impacts that we see is that on a very pragmatic level, there are periods of being understaffed for provider organizations, right? So before we even get to some of the morale and some of those issues and the effects on families and the ability to implement well, there are open positions, right? So what we saw in the data here is that 34% that they said they were not usually understaffed, right? And we also saw that variability in turnover rates itself. 38% on and off being understaffed, but there's 28% if we combine those last categories who are often or chronically understaffed. So obviously that alone is going to have an impact on the ability to deliver wraparound, to engage in those wraparound processes. So then we asked the care coordinators, supervisors, and administrators all have the same kinds of questions of responding to different scenarios as significant problems or less than significant problems. And we see some subtle differences here in the way care coordinators, supervisors, and administrators answer those questions. Not a surprise, right? We have different roles, and thus we have different perceptions of what is the most either important, or at least in this case, maybe not important problem, but the most significant problem, impactful problem. Having empty positions increases the workload of direct service staff. Here we see the care coordinators. I think you can see my cursor, the care coordinators and the supervisors, 43 and 46% saying that is a significant problem, a little bit less for administrators, whereas your supervisors and administrators are a little more likely to focus on some of the pragmatic issues of filling those positions, the costs for training, job search costs, and the time and all those kinds of things being important. We also see some differences in, again, similar kind of slide here of the quality of care, right? Supervisors tend to be really tuned in at least a third. That's a significant problem. This doesn't mean they don't see it as a problem, just that at that highest level. Like this is a high level significant problem that care coordinators, newer care coordinators, take a little while to settle in and be trained up, and maybe can't provide that quality of care. Thus, they provide a slightly lower quality of care initially. Kind of makes sense. And also that new staff cannot work effectively with existing system partners. It takes time to do that, right? So we saw that as another problem that was noted. Most comment, much as you all did in your comments here, on the impact that this has on children and families, right? 43% of care coordinators, 60% of supervisors, and 55% of administrators believe the care coordinator changes significantly hurt families. We pulled one quote here that illustrates that from some of the qualitative or open-ended questions that we had. This person said, I feel passionate about having high expectations and providing high-quality care for families. That said, it is stressful for families when they transfer from one care coordinator to another care coordinator because their former care coordinator left because of demands of role are too high. And those are the kind of comments we got, and the data support those sentiments there. All right, so now we've established we have a problem, right? We have a problem in terms of high turnover, and then there are negative impacts in terms of implementing wraparound, in terms of effects on families, at least those perceptions that people are having of that impact. And they are consistent with what you all said as well. So what's the next step? Well, then we looked at what are some of the predictors, with the idea that if we can find out the factors that are associated with turnover, perhaps we can prevent them from happening. So we have another poll. This one is multiple choice, right? So what do you, there's no right or wrong answers here though. What do you think is the most significant predictor of turnover, okay? And these were drawn from what we saw in the data. So you'll see what others thought, but job stress, too much paperwork, poor salary, lack of training, lack of support, negative organizational climate. And I'm sure all of you will be like, well, all of them. And that's correct, but just let's, humor me and go ahead and see what the most significant in your mind is, and I'll show you what the data show. All right, as expected, a good distribution of scores here. So we have job stress at 18%, paperwork 11%, salary 24%, lack of training 11%, organizational support 28%. So that's actually the highest. They're close, that in salary, and then organizational climate being 8%. Great, and I already kind of prefaced, that's what we saw, that there are a lot of reasons, and it's hard to name just one, and they all interact, right? Just to put out there in terms of, I kind of anticipated where we would land, salary and org climate being important among these other things, or organizational characteristics, I'm saying climate more broadly there. Where did we find our salaries? They ranged, not surprisingly. So we have care coordinators in the dark blue and then supervisors in the gray here in terms of salaries. Most care coordinators are making less than $50,000 a year. Most supervisors are making slightly more. It is slightly more. If you look at the distribution here, most of the supervisors are in the $50,000 to $59,000 range. See the distributions. So not surprisingly, you see, like I said, a little bit higher for supervisors. But I think we could all agree that the salaries are not exceptionally high for our care coordinators and our supervisors. I did, on future slides, I'm going to show some data related to salary, and we did adjust for cost of living. I'll just note that now. Then if we look at kind of organizational characteristics and climate, where people are in terms of feeling adequately trained, supported, and whatnot, we see most ratings somewhere in the middle to a little bit towards the upper end, right? Feeling adequately trained and supported, that's really good. They start to drop off a little bit, and we get to enough staff for caseloads and fair workload conditions, and especially then we get down to access to timely and quality services. So some room for potentially some changes there, and we'll talk about on the next couple of slides where and why that might be important. So looking at participant responses or respondents to the survey, their responses on predictors of what they see as the most significant problems in terms of leading to turnover. And not surprisingly, poor pay and benefits is there, right? And it's directly proportional to, or say they're kind of reverse of where we see the salaries. So care coordinators tend to be the most concerned about salaries. They also tend to be the lowest paid, with supervisors in the middle and administrators a little bit lower. But all seem to agree, right, that salary is an issue. Emotional exhaustion, both care coordinators and supervisors are pretty equally. They're saying that this is a problem in terms of we're going to look at trying to retain a workforce. Emotional exhaustion is one of those factors that seems to be promoting turnover. Job demands, all are pretty equally concerned about job demands being too high. Supervisors, all were concerned about paperwork, but supervisors particularly so, with 61% saying too much paperwork is contributing to our turnover. Okay, now I'm going to look at this. This slide is kind of big and ugly. I apologize. It's actually digging a little bit into what the data say. What are the actual statistical relations across these different variables? So for those that haven't had stats in a little while, these are simple correlation coefficients. If you remember stats 101, correlations range from -1 to +1. Both of those ones, -1 and +1, are the highest level of association between two variables, with 0 being there is no association between these two variables. So what we see, I'm going to use the supervisor column first to illustrate some of these. So a -0.33 in our field, that's a moderate sized correlation. It's negative. So negative means as one goes up, the other goes down, right? So as salary goes up, the thought about leaving your current position goes down, okay? And you see for supervisors, there's a -0.33. That's kind of a small to moderate correlation. Some of these are getting fairly large for our field. So 0.64 is a relatively large correlation. So having resources, if you have adequate resources, you are much less likely to see these individuals thinking about leaving their positions, okay? The most surprising point on this slide, and I'm sure those of you who already kind of looked through can see, is the fact that the, I go back, got excited and tried to highlight it. We had virtually no correlation for starting salary and care coordinator thought about leaving their current position, okay? So it suggests that salary is not the primary driving factor for thinking about leaving your position among care coordinators. It is for supervisors. So we'll look on the next couple slides at some of the other factors that we see here. I'm going to show these graphically. The correlations do a nice job, but I'm going to show some of these graphically when we kind of look at those characteristics of the workplace and whether they are perceived as being there or not, and how that relates to thinking about leaving your job. So in this first one, having your workload fairly distributed. The light blue bar, for those that strongly agree, yeah, my workload's fairly distributed, they're around a 2. I'm thinking about leaving. So close to never, right? You know, they're thinking a little bit, but not very often. Whereas those that strongly disagree, like, no, my workload's not fairly distributed, they're starting to bump up towards this almost daily thinking about leaving. Similar kind of numbers for the adequate staffing resource, or having their resources be available. So some of these characteristics of their workplace are really driving thoughts about leaving. On the next slide, it's even more striking. So organizational supports, and we saw this in some of the comments that you all had. Feeling supported, feeling adequately trained or prepared. For those that feel supported or feel adequately trained, again, they're not thinking about leaving as often. But for those that feel they do not have, they strongly disagree that they have the support that they need, or they feel that they're unprepared, are thinking about leaving. And we're just in rounding error now of thinking almost daily about leaving their job, right? So it suggests that while we talk about salary, and salary is important, it seems based on these data that those day-to-day supports and whatnot within the workplace are actually driving those decisions, or those thoughts at least, more than the salary itself. And that's illustrated in this graphic here. Okay, so these are the different pay bands. Now, these I should say I've combined in these slides care coordinators and supervisors, just so that we're not going to be here all day looking at my slides, as much fun as it is. But what we see here is that the thoughts about leaving your job ranging from 1 to 5 are all falling about in the middle across less than 30,000 all the way up to that 50 to 59,000. And then what this tells us is that there's not that variability that there was on those previous slides in terms of predicting the thinking about leaving your job. One surprising finding, we thought that caseload would be an important predictor, that those that felt burdened by having an exceptionally high caseload would be thinking about leaving their jobs more regularly. And we actually saw the reverse. Those that had the smaller caseloads were slightly more likely to think about leaving their job than those with the larger caseload. Probably kind of what was likely going on there is maybe we're seeing the smaller organization with the smaller caseloads that perhaps don't have the resources to support the staff, as well as some of the larger organizations. Something we can dig in deeper. Again, a little teaser for the institutes. We'll be presenting some more of these data in our next round of analyses in July to tease some of this out. Okay, so let's talk about retention. One more poll. Name one thing that can be done to retain staff in their jobs. It can be based on the data that we just went through or based on your own experiences in your own organizations. Go ahead and do one thing. Again, no right or wrong answers, and I'll show you what some of our respondents said. And a little teaser, it's interesting to see that they do, of course, follow what we saw in the actual data, but not perfectly. So there's always some anomalies and things that are thrown in there that are a little bit surprising.
I'll leave this open for about 30 more seconds.
Hey, this is Eric. I just thought I would kind of reflect on some of the comments, and we'd love as many comments as folks want to put into the chat as well. But I think it's interesting that some folks are not at all surprised that care coordinator salary does not correlate to thoughts of leaving. As one attendee stated, most care coordinators are not in the work for the money. So that's a very good point, and I agree. I've seen that all over the country and the world. And yet there's others, don't know what role they're in their organization, who say the lack of correlation between care coordinator thinking of leaving and salary is very surprising. So it's kind of an interesting phenomenon. And it's something that obviously every organization and system needs to kind of take very seriously as they analyze their own staff's needs and feelings. But across the country, it's just a really interesting set of findings to see that those other factors are so much more overwhelmingly important than salary. Those culture, climate, support, transparency, and responsiveness of the organization. Such important information to get for us.
Yeah, agreed, Eric. And we'll drive that point home a little further on some of the slides that I'll a few more to go through. Looks like the poll results are in. Matt, maybe you could just read 4 or 5 examples, just given time. I want to keep us moving forward, but maybe 4 or 5 examples of what people said.
That sounds good. So a bunch of them are sort of repeated. So I'm just going to look for the first 5 sort of new ones. So the first one would be incentives. Second one, meaningful feedback, more flexibility, more coaching and training. And this one is 2 in 1. Clear expectations around job duties and performance, and also fun off-site relationship building.
Great. All right, let's move into kind of what we saw in the data here. So this question was one of those you could kind of choose multiple responses in the question. So which is why you see the numbers are not going to add up to 100, much more than 100. But by far, and this goes into what we see in some of the comment boxes, some of what Matt just responded to, and some of what Eric's discussion alludes to as well, that we see what's keeping staff in their jobs, it really tends to be more this mission relationship is the more important, right? Dedication to children and families served, passion for Wraparound's mission, strong peer support network. You get down to compensation. It's there. It's important, but it's not what's really drawing people in to do and to stay in their roles doing this work. Now that said, when we look at what would you do to retain people, what would make you stay in your job was I'm sorry, the question here in terms of very workplace specific items, increased pay by far is the number one thing that's mentioned, right? I think we could all agree to a certain extent we're willing to deal with certain shortcomings in other ways if we are well compensated, but that's not what's bringing people to this work and really keeping them there in the first place, right? The salary is obviously we need salary, we need to have our basic needs met and all those good things. But other factors are important, but we don't. And I think what this slide is saying, we cannot ignore the fact that salary and other workplace improvements cannot be ignored either. Okay, some of the open-ended question that we had for on the survey kind of mirrors some of the things that you all just shared now as well. Things like increased pay, reimbursement for travel, flexibility. I heard that Matt mentioned as well. More services that are available for families. Flexibility in terms of hybrid or work from home options and those types of things as well. So this is just sort of a little sampling of some of the things that we saw there. Okay, more slides. I'm going to turn it over to Kim. First, just really quickly, the main point of this slide, I'm going to go through this very quickly because what we saw in 2024, things are very similar to what we saw in 2017. Some differences. Turnover rates overall were a little bit less, 34% versus 40%. They varied by organization both times, but we did see more turnover within the first year in 2024 versus in 2017. So while there was less turnover happening, it was happening more commonly in that first year. Otherwise, the last bullet point, if it looks the same to you, it's not a typo. We still saw salary was an important contributor, but climate factors and other organizational related factors were more important. Or maybe not, I won't say important, it's not that word, I'm talking important statistically, had more statistical significance, had more significance in terms of being a predictor of turnover than salary. All right, so last slide before I turn it over to Kim, and you don't have to hear me talking about this. If you did kind of, your mind wandered a little bit and you want to come back, here's the Cliff Note version of what we found in 4 simple bullet points. Altogether, these findings suggest that turnover rates among wraparound care coordinators and supervisors are similar to those for other behavioral health providers, from 30% combined, or 34%, 24% or so, respectively for those groups. Turnover does have an impact on staffing, service provision, morale. We found that wraparound does not necessarily pay particularly well, but salary might not be the most important factor, as we just talked about. But as I just said, we don't want to ignore the low salary problem. Like I said, the relationships that I showed and whatnot, even with cost of living adjustments made, we still see the same kind of trends of salary not being the most important predictor from a statistical perspective, but something we don't want to be ignored as it is commonly mentioned as a retention factor that is important. Okay, so let me move on to have Kim share some implications of this work with you. Let me go to the next slide. And then I can answer questions during our last half hour for those that can stay on.
Yeah, thanks, John. We can go on to the next slide. I really think it's just a duplication that we could probably go on to the next one because we are indeed going to talk about implications. And so overall, I see a lot in the chat about salary, right? And we know that retention isn't solved by salary alone. I think we all know that organizational culture and direct support matter just as much. But we can't ignore salary. I think to some of the points in the chat, the cost of living has increased. The burden on families is high. And I mean staff and their families, in addition to the families that we partner with. But from a salary perspective, that burden is high. And so we do need kind of a both and approach. And so let's break it down just a little bit further and look at implications specifically for organizations and for systems. So John, we can go to the next slide. And we start with kind of those implications for organizations, because workforce turnover is really a systemic issue. It's not just about individual burnout. That we need to emphasize, the organizational culture, staffing ratio expectations. That means the ratio between the care coordinator and the families that they're partnering with, and also the ratios of supervisors to the people that they supervise. So supervisor to supervisee ratios, as well as support around not only supervision of staff, but that staff are participating as part of supervision efforts, and not forgetting structural challenges, right? That it's not simply an individual characteristic that's pushing one way or the other. And those organizational conditions are really important. That idea around flexibility in their roles, as well as administrative burden, which I'm going to talk about when we talk about systems. But also that pay and career paths are necessary, but that again is not the only path. That we need to make sure that we have career ladders, that there are credentialing opportunities, that there's role clarity. Those expectations that we talked about earlier are so important, and that compensation needs to align with the complexity of the job. This has always been so interesting to me that that the staff that we're expecting to partner with young people and their families with the most complex needs in the system are oftentimes paid less than other roles in human service. And I don't know. I just want to throw that out there, that we're always curious about that. Which again, I think gets into those system implications that we're going to talk about. Also, I think there could be an over-reliance on technology, or not technology, I'm sorry, training, because we think that training alone is going to fix it, or going to address kind of those issues. But it's really time, policies, supervision, support. Staff want to feel good about the work that they're doing. And so, again, just thinking about what we can do organizationally around supporting people and investing in technology that I brought up just a minute ago, that streamlining processes, how do we reduce that administrative burden, right? So next slide, John, as we talk about implications specifically for systems, and that we need to think about state mandates, funding structures, outcome expectations. And so as systems, we have control over that. And, maybe we could push on those levers a little bit, but also maybe adding workforce retention to CQI oversight and considering that a positive outcome for the future, I think is really important. And integrating that into contracts, into whatever system oversight levers that states may have to consider those. And also recognizing that staff feel a real pull between the expectations around system pressures and wanting to support family needs. We saw in the chat that people are talking about or bringing up the fact that care coordinators and staff don't really get into this work to become rich or make a ton of money, but they do need to live, right? But they also want to help people. And so when they're not able to do that, because of the administrative burden, the paperwork, the documentation, all of those things come into play. Even thinking about, as a concrete example, when we look at fee-for-service spaces where wraparound sits, and 15-minute increments. That's hard, right? When you think about the documentation at an organizational level and at a staff level required to maintain that kind of structure and billing and all of that stuff, it's hard. And so how can we start to look at other ways maybe to fund this work, and really make sure that staffing ratios are low, that staff feel supported, and how can systems enhance their advocacy for that, through policy, through cross-agency partnerships, and so on, and making sure that we're investing in workforce, that they can participate not only in training but also in coaching, and supervisory support, that all of those components are there. So just thinking about how can we be flexible in our support, and helping the workforce feel like the work that they're doing is important, and valued. And so I think that brings us to time. We do want to open it up for questions, and I also want to remind everyone about the training institutes. I think there were some links in the chat. We look forward to seeing you all there. And then I want to encourage my co-presenters to come off or show themselves, and we can answer any questions that might have come up in the chat, or any last thoughts.
As well, if anyone would like to come off mute to ask a question or to provide a comment, please use the raise hand feature, and then we will unmute you. Otherwise, please feel free to put any questions you have into the chat.
And of course, it's the top of the hour, so if you all have to go other commitments, it's understood. You can always follow up. I'm happy to answer any questions about what I presented today, and I'm obviously Tony and Kim as well. So please let us know. And then again, shameless plug, we're gonna dig in more on the data side for the training institutes as well. So
those who want to stick around, Kim, I've got a question for you. So those conditions, as we have learned, maybe someone can drop, there's so many links to things, resources, studies that we could provide to folks. But one that John spearheaded showed that the state context around the system, its rules, how they contract with organizations to provide wraparound and other services, like you referenced, the fiscal and the fiscal arrangements. Is it going to be a quote unquote case rate per member per month, or is it fee for service? All those things affect staff's ability to do this kind of work. Is there something, are there resources out there that folks in this group who want to have that upward accountability and really try to make change at that probably most important level of the state? Are there resources that they can access, or is there work that we're doing on that topic that we can share somewhere, somehow?
I am absolutely convinced that there are resources that we can share. I don't have them pulled up right now. We should have had those on the ready, or I don't know how fast John is. But there's actually been several studies that have been published around the context of community mental health center installation versus a care management entity installation. As I brought up, and as you reiterated, the kind of fee for service approach versus per member per month, or some sort of monthly rate that's paid, and administrative burden. I think that we don't, as systems, have good responses to reduce paperwork and all of the things that go along with that, and not having the technology infrastructure, I think, is huge. So it looks like Eric popped a link in that will link you to all of those resources that we just talked about. But it really is very, very important that we don't put the burden of all of this on the frontline staff. Like, they got into this work to help families. And so how do we help care coordinators, facilitators, and supervisors do the work that they want to do, and still recognizing that organizations need to get paid because they need to pay people, right? And people, staff have families and so on. But the systems have a lot of control over those things. And we're happy to help systems think through, like, what are better ways to do this? Because I think we all are just reacting to, here's a problem and here's how to, how can we fix it? And there could be a better way. I don't know. Maybe.
I saw that Michelle had her hand raised, so I am going to allow Michelle to talk if you would like to contribute.
Oh,
Yes.
it's just me over here. You guys are singing to the choir. I'm just over here going, yes, 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 I need help. So for those who don't know me, I'm a statewide administrator in Illinois, and you're spot on, Eric and Kim, with your statements that those of us who are in those roles to make those things happen or influence those decisions at a state level, we need all the guidance we can get, or I need all the guidance I can get to make sure that we're not putting more administrative burden on the front line. And I think that some days I feel very guilty of that, and I'm aware of it. So I really want to make sure that I'm doing the best I can as an administrator in that role. So any guidance would be greatly appreciated.
Yeah, and I mean, your point is well taken too, that you all are doing the best that you can with the resources that you have, and we acknowledge that all through the system, right? It's just sometimes I think that systems don't think they have as much control as they do, or how do changes get made when things have been in place for, I don't know, 30 plus years. It could be longer than that, but we're operating in spaces that really haven't changed in a really long time. And it is interesting, the states that have found creative solutions to challenges, we've found often do better when you look at outcomes for families. And I think the resources that Eric linked in the chat are certainly worth taking a gander at. And then we're also really glad to help with that. Tony, did you want to add something? I saw you come off mute.
Yeah, and this kind of, Nancy just kind of mentioned this, but I think I'm an evaluator, so I'm a big proponent of what gets measured gets changed.
Yes,
And so one
absolutely.
of the things that we've recently incorporated into all of our continuous quality improvement plans is assessing staffing and staff satisfaction, because I think just as we do with families and ask how they are satisfied with services, if states or systems are struggling with retention, I think that same process still exists for them to be able to monitor and track how they're doing in staff retention, but also staff satisfaction, to better understand, make data-informed decisions about what they can do and where the struggles are for state, the workers in their state who are providing the service.
And I do feel like we would be remiss not to talk about the role of managed care organizations in systems. I know, we're kind of at our Q&A portion of the presentation, but from a state perspective, I don't know, it's almost like things kind of enter into a black hole of managed care, right? That we're not really sure what then happens at the state level when things flow through a managed care to providers, and it may be a little harder to check in around or see what's going on. And I think that that's a contractual space too, with policy and regulation around that. And we hope to have more conversations around the impact of managed care in the work, not just for wraparound, but for behavioral health in general. particularly as it relates to children. So maybe in a future presentation, we can talk about that. I know Eric really loves to talk about that too.
Like you say, it seems as though there are folks who are in roles to dictate the way in which a state will contract with different kinds of entities to provide this critical resource to families that could influence hundreds of lives, thousands of lives, and tens of millions of dollars. And yeah, I would agree. We, especially around the question of, how can managed care play a positive role, or at least be avoid states avoiding it being detrimental to the quest that we have to improve families' lives when they have young people with complex needs. I think that there are some points that we can get out there that are pretty fundamental and basic. There's a lot of them, but I think we can and should put them out there for folks. So yes, my opinion about this, and yet I'm not the expert. I'm just a research guy.
In the chat, I put 2 questions into the for you all.
Yeah, I wonder if whoever posted those would want to come off mute and just give us a little more information. The first one is, have you considered contracting with, I think, RAP facilitators outside of mental health centers? Possibly individuals with case management backgrounds who could go through the certification process. Not really sure. But if you want to come off mute and give us maybe a little more information, we'd be happy to answer that. Kenya, was that your question?
Yes, it was my question. And first, I
Okay.
it was just an awesome presentation that I attended accidentally, just to be. I
Well,
have
I'm glad you accidentally showed up. That's great.
Well, and here's why. So basically, I have been a contractor working on behalf of community mental health wraparound for 16 years, and I've served in all positions as a RAP facilitator, a HAP provider, FST, and now as a facility-based respite provider for children who are in part of the CMHW program. But I asked that question because I've experienced it from a RAP facilitation standpoint perspective, as well as a direct care provider working as a HAB FST, where the continuity of care has kind of been greatly affected because, whether it's high turnover, and, so there's this plan that doesn't get approved because wherever that person fell off and left off, the plan wasn't completed. So now providers are left without service units to serve the family, and the family is left without services. But I asked that because I just knew there were a lot of high-level, skilled-level case managers who could coordinate RAP facilitation services had they been trained as RAP facilitators. And so I was just curious to know if it was ever considered to look outside of managed care entities and mental health centers, formerly working in DCS and all. I mean, the level and nature of organization that's required to facilitate and operate on that high fidelity level, you can get some of those skills from people who are former DCS workers, or people who are just case managers. So I didn't know if that would help to expand the pool of people to recruit from, or what that even looks like. But just curious.
Yeah. Well, I mean, it's awesome to hear, your enthusiasm for the expansion of your work. And that's great. So thanks for coming off mute and talking to us today. I think that a lot of the work that we do around training, coaching, and certification is at kind of a statewide level and what their installation efforts are. So we as NWIC don't necessarily limit the people that are in those roles. for a particular state. I mean, states do it differently. What I will say though is that it's really important to think about dedicated staff, and that the
Right.
folks that are operating in a care coordinator space aren't also providing other functions or doing other work with families, and so on, because it's just hard. It just it's really hard. And fidelity is impacted. Having done the work, I know that I can't imagine like having multiple roles with a family and being able to do the work that I did as a care coordinator, and partnering, with about 10 families at any given time. And I think that sometimes that, as the data have showed, leads to staff burnout, because they've got so much going on. And so I think that that's really important to note. And again, it really is the context in which wraparound is being installed that leads to the individuals that are participating in that. So
Absolutely agree. One wholeheartedly to that. Being a former rep facilitator, I would have never would have been able to probably manage that all. So I was just specifically speaking to maybe partnering with those departments to carve out something specifically for rep facilitation. So if I didn't make myself clear, but I agree with you 100%. I agree 100% with that. Just wondering if there were other entities that could do it other than managed care systems or mental health centers.
yeah.
That was just my curiosity.
Yeah, absolutely. I mean, like I said, there's no real, limit, I think, to the possibilities out there. It's more dependent on the state structures and who has access to get reimbursed for the work.
Yeah.
And so, but we're happy to continue the conversation, or talk to you offline, if you
Thank you so
want.
much.
The exact question that we asked in that paper, probably a few resources I posted ago, is whether or not you get better quality and fidelity of care at the family level when you use entities that are dedicated to serving as a care management entity or organization versus vesting that service within that kind of more traditional community mental health center, for example. And some states have done that. Best example, probably at least the longest standing example, being the state of New Jersey, which has just completely transformed the way it provides care and has documented the cost savings and the improvement in so many thousands of families' lives by being committed to that approach. And yet somehow it's not the norm. It's not, and as Kim is suggesting, it's doable. Takes a long time. We have other research that shows it can take 4 or 5 years minimum to get to the point where you have that kind of well-functioning, well-installed wraparound programming within a state system. In New Jersey, they'll say that it's been a 25-year journey and it's still going, but it can be done. And when you document along the way, like Tony said, what measured gets managed, what measured gets done, amazing things can happen that are against the norm and yet way better for families. So we all have to advocate for that. Right? Ohio is, and there are states that are now, kind of trying to emulate that, and it's going to be a hard road for them. And yet it's worth the effort if it can be done, if people can persist and support leadership, both by trying to be voices of how well is this working, supporters of the change, critics when necessary, but it's people working together and sustained leadership towards a vision that allows it to happen. And I think, Sarah, Ohio, you're noting a great example. Ohio is attempting to do this, and it's really challenging at the same time.
So there's another question in the chat from Tammy about reimbursement for staff, and indicating that staff have to work billable wage until their wraparound, staffing ratios build? How are others paying their staff as they transition? And I think that is the perfect question to, provide an example for how systems are doing this work. And it speaks to what Eric just brought up around what is the infrastructure, and how are systems setting up their approach to wraparound, and that fee for service space is challenging. And so I would encourage you to go look at that paper. And then if you have any questions, please feel free to reach out, and we're happy to work with you specifically, or talk to you about some potential options for your organization. Anything else in the chat? Any other questions that people wanted to raise up?
Doesn't look like there's anything in the chat at the moment. If anyone wanted to come off mute, please feel free to raise your hand and we'll unmute you, or please put your questions in the chat.
Well, great. If there are no, oh wait.
Yeah.
Has anyone done fee for service? Oops, it's moving. Well and sustained high fidelity wraparound. Michelle, are you asking us? I feel like you are.
Well, yes.
Yeah, I know. I'm like, Tony, you came off mute.
Oh no, I was going to read the question. I don't have an answer.
Oh, I think that there are some organizations that have operated, in that space. I will say that data support, other structures that work better. So the per member per month rates, or a standing kind of case rate approach. We see that providers under a fee for service can take the practice to a certain level, but then they kind of hit a wall around, I don't know, I am not your data person, but I'm going to say around 50, percent of of skill attainment that we would want to see, right? And then there's kind of this plateau, right, where they just can't seem to break that wall to build really good skill for staff. And I think it's because, or I would hypothesize that it is because of the structures on top of providers, right? And so it's not that they're not doing good work. They are. They can just only take it so far without the support of the system and so on. And that's what we've seen is really that plateau out. Tony, did you want to?
Well, I'm thinking about data because I am the data side.
I know you.
Well, 50% sounds good. But I'd be interested in our data. Like this is maybe next step as people say that they're interested in following the research is, can we see in our survey data here, I don't know, and John, you may know this, if we can split our sample by, can we identify those who come from a fee for service system, and do the things that drive their turnover differ?
Yeah.
Right? So the demands that the system puts on folks creates differences in how they perceive their work. So that'd just be an interesting thing to see if the administrative burdens the caseload, because I would imagine they have to fill a certain number of hours. And so those requirements may change what drives their turnover.
Yeah, it's a good question, Tony. We do have, we might, I'll qualify it, be able to dig in a little bit based on the provider organizations that responded. So, but this is exactly where I'm hoping to go with this, along with you all, as a collaborative effort to become a little more nuanced and move beyond. Today was really the large, broad brushstrokes of what we see going on out there. And now to really dig into the data a little bit more, the kind of subgroups. And I think that's kind of the next interesting step to see if we see some trends. like what we're discussing. So.
Yeah, I agree. We can, just like we have with Fidelity, we at the Wraparound Evaluation and Research Team and National Wraparound Implementation Center try to take every opportunity we can to analyze data that are available to answer some of these questions. And so now the workforce data that has been collected and in the beginning of which have been presented here can provide another such dependent variable. What matters? That's what we've done with Fidelity. When we did our analyses of whether or not care management entity kind of organized states versus more traditional community mental health center organized states, how fidelity varied by the two, it wasn't as though it was like all bad for more traditional and all great for the care management organization states or care management entity states. It was a continuum with a trend towards the care management entity invested states having better fidelity and satisfaction among their families. But it was it was a continuum, and really what we see in the data and hypothesize is it's not some sort of magic on or off switch. It's how does it actually how does whatever method a state adopts or methods, how well does it align with what we see the system conditions should be? Are data being collected and used in coaching? Is there, and continuous quality improvement? Is there indeed greater flexibility in families' individual per member per month rate is one factor, but then there's also things like, is there a statewide center of excellence doing a consistent training and coaching of the staff to skill achievement? These are characteristics that are more likely to happen in some states, like those that have those hubs of accountability for providing wraparound versus those doing it more traditionally. But you could probably achieve that in a fee-for-service system if you could figure out how to do some of those other things, driving with data, getting people skilled, making sure you're attending to climate and culture in your organizations, having firewalls between the care coordinators and the other providers in your mental health, community mental health center, so that they're not just defaulting to the same service every time. They're actually planning around families' unique individualized needs. So there are ways that you can achieve high quality services in a lot of different kind of contexts, but there's certain things you can do that are going to make it more likely that you're going to achieve those conditions. Long-winded answer, but it's important for folks to recognize.
Yeah, and just to reiterate that a care management entity, just in case there's folks that don't know, they are only responsible for the coordination of care for the young people and families that they're partnering with. And so they don't provide other service provision. And that structure we know is, the outcomes for that are better. Staff build skill more quickly. There's less turnover, higher retention rates, better outcomes for family. So that structure I do think is important in all regards to the work that we're trying to do.
There were two questions that came up, and I know we only have 5 minutes left, so I just want to throw this to probably Kim and Eric. Best place to learn more about New Jersey and how they are running things in regard to wraparound services.
I feel like Google has a great option for that. I think we have some New Jersey friends on the call. If you happen to know and wanted to pop that into the chat for folks.
There is a session about it at the training institutes.
There is. There is that too. So we'll plug that again. But I don't have it on the ready, but I know a lot of New Jersey's policies, regulations, approach data, all of that work is online. So was there another question, Tony?
Yeah, Michelle asked, how does structure impact turnover or support retention? I think we've talked about that in some regards. And hopefully we have some data too. Like that's, I think, from my perspective, like having some findings from the work we've done to support some of that. I think Eric hit on a lot of those in his response around the creating an environment that allows for the supports necessary or increases the likelihood of having those supports is probably a better way to say that.
And so, Sarah, I think your point about Ohio, right, between your Center of Excellence, your managed care organization or your ASO, and then your state structures, like it's complicated. It's not easy. It's complicated. But we do appreciate the work that you all are undertaking there, and that you keep showing up to the table to try and address those challenges. So that's great. That's the first step for sure. I think we're almost out of time for today. I want to thank you all for coming today and for opening up in the chat or unmuting yourself, and great conversation. So thank you all.